Today, we're diving into a silent threat that can grow inside you for years, often without a single symptom. We're going to break down the science behind one of the body's most dangerous hidden conditions, the abdominal aortic aneurysm.
I want you to imagine the main water pipe that supplies your entire house, okay? It's under constant, massive pressure every single day. Now, what if a weak spot on that pipe started to bulge outwards, with the wall getting thinner and thinner over time? Well, that's pretty much what we're talking about today, except it's not in your house. It's happening inside the largest and most critical artery in your body.
So an abdominal aortic aneurysm, or what doctors call a AAA, is basically a permanent bulge in the aorta. And the aorta, that's the superhighway for blood carrying it from your heart down through your abdomen. Medically speaking, it officially becomes an aneurysm once that artery swells up to 3 centimeters or more in diameter. It's this quiet weakening and stretching that really is the heart of the problem.
And this is why it is so incredibly dangerous. What you're looking at right here is a CT scan of what happens when that bulge finally gives way, a ruptured AAA. This causes massive, absolutely catastrophic internal bleeding. It is a true medical emergency. You see, the real danger isn't the bulge itself. It's the life-threatening risk of it bursting.
So, the big question is, who is most at risk here? Understanding these key factors is so important because, like we said, this condition almost never gives you a warning sign until it's way too late.
Okay, let's be blunt here. The single biggest, most powerful risk factor is cigarette smoking. The link is just undeniable. And every year someone smokes, that risk climbs. Of course, things like your age and family history play a huge part too. Your risk roughly doubles if a parent or a sibling had one. And yep, other conditions like heart disease and high blood pressure are also connected. Now, there's also a really stark difference between men and women. Abdominal aortic aneurysms are 4 to 6 times, that's a lot, more common in men. This difference is so big that it's actually led to targeted national screening programs in many countries that are specifically for men. But, and this is a really important but, here's the twist. While these aneurysms are way less common in women, if a woman does develop one, her risk of it rupturing is actually higher than a man's, even at the same size. It's a critical reminder that risk isn't just about how common something is. So, if this is a silent condition, how in the world do you find it before it turns into a life-threatening emergency? Well, the answer is proactive screening. That's the safety net. And this right here is exactly why screening is so vital. The vast, vast majority of people with an unruptured AAA feel totally fine. No pain in their stomach, no back pain, 0 symptoms to suggest that something is brewing. That's why they're often found completely by accident during a scan for something else, or, you guessed it, through a dedicated screening program. And you know, the tool they use to find it is surprisingly simple, and it's completely painless. It's a standard, non-invasive ultrasound. We're talking about the exact same technology used to look at babies in the womb. It's quick, it's safe, and it's incredibly effective for diagnosing and keeping an eye on an AAA. Once that ultrasound is done, the path forward becomes remarkably clear. This table, which is based on the UK's national screening program, lays it all out pretty neatly. If your aorta is a normal size, so less than 3 centimeters, you're good to go, discharged from the program. If it's a little bit enlarged, you just enter a surveillance program with regular scans. And if it hits that critical size, 5.5 centimeters, you're referred to a vascular surgeon to talk about the next steps.
Now, getting that referral doesn't automatically mean you're headed for surgery. Nope. In fact, finding an aneurysm kicks off this really careful decision-making process. It's a balance between 2 very different paths, watching and waiting or taking action. For the smaller aneurysms, the go-to approach is what's called watchful waiting. This just means regular ultrasound checkups and really aggressively managing those risk factors we talked about, especially, and I mean especially, quitting smoking. But for the larger ones, where the risk of rupture starts to become greater than the risk of an operation, then the path is repair. The whole goal is to be proactive, to fix the problem before it can ever become an emergency.
So, when the decision is finally made to act, what does that actually look like? Let's take a look at the 2 main surgical techniques used today to fix an aneurysm.
So the traditional way is open surgical repair. This is a major operation. It involves a big incision in the abdomen, and a surgeon physically sews a synthetic tube, a graft, into the aorta. But what's become far more common now is something called endovascular aneurysm repair, or EVAR.
This is a brilliant, minimally invasive technique where surgeons make small incisions down in the groin to guide a stent graft up into the aorta. Basically, they're relining the weakened artery from the inside, and the recovery, dramatically faster.
And these are the incredible devices they use in EVAR. They're these sophisticated fabric-covered stents all compressed down into a thin tube called the catheter. Once it's guided into just the right spot inside the aorta, the device expands, kind of like a spring-loaded scaffold, and it creates a brand new, reinforced channel for your blood to flow through safely.
And here is the beautiful result. This is a 3D scan showing that stent graft perfectly in place. You can see so clearly how it creates a new, safe pathway for the blood, completely sealing off that weakened aneurysm wall from all that intense pressure. The bulge is still there on the outside, yeah, but it's no longer a ticking time bomb. It's just a really elegant solution to a very dangerous problem.
So what's the big takeaway here? An abdominal aortic aneurysm is for sure a very serious condition, but it is not a guaranteed catastrophe. By understanding your personal risk factors, especially if you're a man over 55 with a history of smoking, and by using the simple, painless power of ultrasound screening, you can find this silent threat. You can literally turn a potential emergency into a totally manageable condition. So the real question isn't whether the threat exists, it's whether you know enough to look for it.